Dr. Bien Nillos is currently the Municipal Health Officer in Ilog, Negros Occidental. He's a former doctor to the barrio and distinguished himself in his batch as the most outstanding doctor to the barrio in 2009. Former faculty, the Behavioral Sciences Department in the LSU, and currently teaching at University of St. Rizal in Bacolod City. So let's give a round of applause, a Zoom applause to Dr. Bien Nillos. Bien?
Grabe, Doc, no? May Zoom applause na pala.
Oo.
How time have flown, no? It's been a year since we are in a pandemic. So, Doc Elmer, thank you for the invitation. It's nice to be with fellow Lasalians this very, I don't know with you guys there, but it's a very warm afternoon here sa Bundok. So I'm actually in my clinic now here sa Bundok. So I was asked to talk about the role of academic institutions in local health systems development because actually in my previous work as a Zwillig Family Foundation Director for Community Health Partnership Program, one of my tasks before was to network with a lot of academic partners nationwide to help the foundation where I work for in the creation and spread of the training modules that we do, for leadership and governance. So we were able to partner with a lot of academic institutions across the country. So we started that. And I see the value of academe, no, in local health systems development. So Doc Elmer, I can share my screen, no? So yeah, I'll share my
Sure, go ahead.
screen. Sige, I'll share my screen. It's just a 10 slide kasi sabi ni Doc Elmer 10 minutes lang daw. So 1 minute per slide. So well, I was doing this slide while I was making my own reflection 1 year after the pandemic. So yun. So the role of universities in the advancing health systems development. Okay. Uh, like I said, I see the value of uh, the academic partners or the academic institutions in the push for health for all. I think that's the vision of all health practitioners. And this echoes the call to action by the Alma Ata Declaration on Primary Health Care way back in 1978. In 1978, countries assembled in Alma Ata, Kazakhstan, now present day Almaty, to affirm the value and importance of primary health care. And for the first time, the nations that assembled there recognized that health is a right, and the only way to achieve health for all is to address the varying social determinants of health. So, and this group now basically reflects a part of that section of social determinants of health. So may mga engineers, chemists, food technology experts, gender and development experts, leadership experts. You guys are basically the social determinants of health. So that's what the vision is. And if we all remember, the Alma Ata Declaration had a deadline. The health for all was to be achieved by the year 2000. So we are now year 2021. So I'm not too sure if we were able to achieve that vision. So again, in my experience and in my understanding of the Alma Ata Declaration, one aspect for us to achieve health for all is to establish a robust health system. So what do I mean by a robust health system? The health system, of course, must be available. No? It must be available in the area. It must be accessible. It must be functional, responsive, and dynamic, meaning it can adapt to certain changes in time, in the locality where the health system is. And of course, the WHO recommends that for you to establish this robust health system, you need to work on the six components of a health system. They sometimes refer to them as the six building blocks or the six pillars of a healthcare system. And this could also be sort of themes for for any action research that you might be interested in, no? So of course we have service delivery, we have human resources, access to medicine and technology, health financing, health information, and of course the most important one is leadership and governance, which in principle basically drives the rest of the six building blocks, no? So leadership and governance is very important. But establishing a robust health system is not enough. And the Alma Ata Declaration pushed further that we also have to take care of the social determinants of health. And WHO defines the social determinants are being the conditions in the environment in which people are born, where they live, they learn, they work, they play, and eventually where they die. So, and this environment affects a wide range of health, functioning, and quality of life outcomes and risks. So, it ranges from poverty, education, all the way to ecology and environment, and all other factors that can particularly directly affect or even indirectly affect health. No? So that's why in nutrition we have nutrition sensitive indicators. We have those kinds of aspects to recognize the importance of social determinants. And as a public health practitioner, as a municipal health officer, most of my attention and focus is on the social determinants because it's very important. We would rather have people prevent the onset of disease rather than curing them because of their disease. So this is very important. And I guess the 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 occurrence of the COVID pandemic basically unraveled that in the Philippines we have lackluster health system, and we don't have a buffer of social determinants that can basically support us. And that's the basically the lesson learned after 1 year of being in the pandemic. So it has to be a two-pronged approach, one short term, one long term. And I see the value of the academic institutions in this case because uh, the local health systems and the academic institutions actually complement in so many ways. As the practitioner, the local health systems basically implements a lot of the programs and processes. No? And of course, in order for us to implement effectively these programs, we need competent and skilled health workers or leaders that would drive the health system, operators of the health system, and formation and skills training of these people, no? And also values formation and leadership formation can actually be fostered in an academic environment, which can be provided by academic institutions. Of course, local health systems being more embedded in the community, they have a good knowledge of the norms and culture of communities where they operate because basically the people who operate the health systems actually come from these communities. No? However, because they are so embedded in it, um, there's a very there they could not really sometimes see the bigger picture. So sometimes they work in silos rather than seeing the bigger picture, and I think that's where the academic institutions come as well, because you have the skill to study how these norms and dynamics in the community get integrated, especially into the mainstream healthcare practices and policy and programs. Of course, local health systems would establish the programs and processes that would produce the evidence later on that will be translated into policy. However, local health systems most of the time stop there. They don't know what to do with the information that they have. So that's where academic institutions come in because the skill of the academics is to the academicians is to generate and even analyze the evidence, which would eventually lead to policy making. Because there's a lot of policies that are not grounded on empirical evidence. There's no science behind it. They're so whimsical at times, and most of the time it's very reactive in nature. So local health systems, of course, they use policies to influence processes that would eventually lead to the desired outcomes. However, the academe can complement that process by transforming information that's already there to sound policy, making policy therefore empirical, scientific, and evidence based. Especially in medicine, the new trend now is evidence based medicine. But there's still a very low appreciation for the role of evidence and how this can be used to support certain policies and certain programs. No? So, in fact, while I was making this slide, I was thinking how I wish that for every provincial health system, at least from the provincial level, there is an academic partner to assist the province, the provincial government, to make sense of so many data, of so many information, and how do we use this information and translate them into policy that would eventually become programs that would directly affect people's lives, no, at the ground. So it's an imagination on my part to have sana that for every provincial health system, merong partner or kabalikat na academic institution siguro in the area din, operating in the area that will somehow be used as the processing unit of this information, and maybe even the prototyping laboratory for the province, no? Because if the information would lead to particular solutions, then the academic partner might even help prototype these solutions and refine it. Anyway, action research naman siya. So yes, and in some countries, uh, they have this what they call the academic health center models. So it's an academic institution attached to a health facility or to a health center, so to speak. And this setup somehow does what I just described. No? So the health center or the health facility provides the services, addresses the, the provides the practical solutions to address the day-to-day health or medical problems or health problems of the area, and based on the information, the outcomes, the indicators, and even the information gathered throughout the process, the academic partner gleans this information and provides the theoretical solutions naman on how to refine the practical solutions being provided by the health centers or the health facility. So there are studies being done already on how effective these AHC models are in other countries, no? But basically that's what I was trying to envision eh. Na sana in the Philippines merong ganun din. However, there's a killer assumption there. If you are to do this, the government must be ready to listen, number one, and the academic institution must be ready to make their hands dirty because some governments, whether local or national, they tend not to listen to outsiders. They tend to settle themselves in this echo chamber and pat themselves at the back and grade themselves excellent even if they're not. But so for this to work, government has to listen to everything, even to the negative criticisms, whether negative or positive feedback. They have to listen. They must be willing to listen and take everything in. Because if they don't listen, the whole model falls. At the same time, academic institutions must be ready to get their hands dirty, especially dirty with all the bureaucracy and the politics that's already inherent in any government, whether local or national level. Because a lot of academic institutions are very hesitant to get engaged with any political or any government institutions, whether because they had a bad experience before, or whether they don't trust government, or whether they don't want to get themselves too involved with a lot of the and frustrate themselves with a lot of the politics and the bureaucracy and the red tape that gets it that is basically part of the political structure already. So if the academic institution withdraws from that kind of setup or from that kind of challenge, then the whole model fails because, of course, no one will work with government as a partner. So, for me, those are the two killer assumptions if you want to do it that way. Government must be able to listen, and academic institutions must be able to ready themselves to get engaged in all the hard work and dirty work there is in government as well. So that's what an HC model for me is. And I hope, because what I see from the ground, from my level, we are basically drowning information, but we are thirsting for knowledge. There's a lot of information, even at the provincial level alone. And yet we are waiting for, okay, what can we do with this information? What do we need to do? And that's what we're not seeing or we're not hearing. Again, for some provinces, for some other LGUs, maybe they're doing that. But generally speaking, dito sa Pilipinas, the information gets shelved most of the time. We submit so many reports, they collect so many reports from us, sometimes from a daily basis, and yet we don't we don't get to see what happens with the information that they get from us. Besides reporting it back to us. Like we already know that. Because basically we know what you're already reporting to us because we were the ones who submitted it to you anyway. But what we want to hear is how do we use this information, translate them to policy, to programs, to processes, no? That or strategies that would basically address the problems, provide the practical solutions grounded on scientific evidence, to empirical evidence. Because that's what's lacking for me. Uh, so that's why it reminds me of the famous quote from Rudolf Virchow, no? Medicine is a social science and politics is nothing else but medicine on a large scale. So basically what happens now in our end is the public health practitioner like me tends to act like the academic partner de facto because we have the data, we get to analyze it, then we get to propose strategies to the local government, to the politician, to the political leader, who is basically the practical anthropologist here, who provides for the actual solution. However, not all public health practitioners are equipped in that way, would think that way. In fact, so many public health practitioners in the front lines have been jaded through many years by disappointments in the system that they tend to settle back as clinicians rather than public health practitioners. So so that's where I feel the academic institution should come again and really push and train these public health practitioners, especially the frontliners, on and equipping them with the skills that at their level they can already do a lot of these things that we can expect from an academic institution. So basically that's my introduction kasi intro pa lang naman ako, Doc Elmer. So that's my very short take on this whole collaboration that we'll have. And I'm looking forward to the partnership with DLSU and with the rest of the Lasallian schools nationwide. And because we can actually do a lot of impact if we get to collaborate in this way. So, yun lang po at maraming salamat po.